Welcome back. This sketch will take you on a journey through South America, following the footsteps of Che Guevara, who was incidentally a medical student like yourself. Che will help teach us about Trypanosoma cruzi, the parasite responsible for Chagas disease. So Trypanosoma cruzi is a parasitic protozoan located predominantly in South America, like Che himself. But it can also be located in Central America, as Che was when he was on his motorcycle tour. So to set our scene, this story takes place in a gas station in Argentina, with Che cruising through on his motorcycle. So why did we pick Che? Other than being from South America, check out this gas station. We have a sign here for Che's Gas. A charming place to refuel on your adventure through the southern hemisphere, Che's Gas should remind you of Chagas disease. Now, how does this bug do its damage? It tunnels into tissue and feeds on the blood and lymph of its victim. T. cruzi is transmitted when the vector, a type of bug called a reduviid bug, bites the victim, then deposits infected feces into the open wound. Then infiltration is promoted even more when the victim scratches the affected area. So to illustrate this, we'll have our protagonist of the story, this gentleman right here in the front, who has stopped to refuel his motorcycle, and is seen here kissing his girlfriend. This is because Chagas is transmitted by the kissing bug, the reduviid, so called because it often bites around the victim's mouth. It's also a painless bite, much like a kiss. But remember, Trypanosoma cruzi isn't in the bite, it's in the feces. The bug defecates in this bite wound, and then the human scratches it in. So here on the bottom of the picture, we've drawn what the bug looks like. And this isn't a little small bug either. It's pretty crazy. It's almost like a horror movie if you hate bugs. It's a large bug that creeps up on you at night, kisses you by the mouth silently, and you're left with a devastating, potentially fatal illness. Acutely, the infection may be asymptomatic, or there may be some localized inflammation around the biting site. However, 10 to 20 years after inoculation, a host of horrifying symptoms, collectively known as Chagas disease, may set in. So let's illustrate what happens. Che's bike will be hooked up to the gas tank by a line that looks an awful lot like a large intestine. Notice the haustra and the tinea coli along the line. And note that the end of the line looks awfully swollen, a bit large for a normal healthy colon. This will represent our first symptom. It's megacolon. The presentation of megacolon could be extreme constipation that would eventually require an abdominal x-ray, at which time you'd see a large bolus of poop stuck in the colon. Or alternatively, it could present as an acute abdomen from an already perfed colon. For our next symptom, look back at Che's bike. He'll be carrying a saddlebag, which incidentally is shaped like a large floppy heart. This represents the second symptom, dilated cardiomyopathy. Does this look familiar? If you're thinking of Coxsackie virus, you'd be right. It's a great memory. We use this symbol then also. And dilated cardiomyopathy is what many patients with Chagas die from. So over here in the front of our illustration, we'll draw a snake, recently fed and happily sunning itself. Its throat is dilated as the meal travels down slowly. This snake represents megaesophagus, our last important symptom of Chagas. So remember megacolon, megaesophagus, and dilated cardiomyopathy. Chagas makes things dilated and massive. You should know that Trypanosoma cruzi is diagnosed by blood smear, which is used to visualize motile trypanosomes, but only during an active infection. We've illustrated this by having the gas line leak gas, which looks like blood. So this blood smeared on the ground is for blood smear. So in chronic Chagas, on the other hand, so not in active infection, can be diagnosed via serology and with clinical symptoms. Also, just to hammer the bug name reduviid home, check out the bright red bug we've drawn on their dilated heart bag. This will help you remember red for reduviid. It's also to remind you that trypanosomes themselves can be found within cardiac myocytes on a heart biopsy. While heart biopsies can help with the diagnosis, they aren't very convenient to do, and so they're not frequently done. So how does this parasite get to the heart? Well, we already talked about how it got into the bloodstream, but after it gets into the bloodstream, it actually burrows into the endocardium. So to illustrate this concept of tunneling or burrowing, We're going to draw on this mole here on the right who's just tunneled up to say hello. Lastly, let's talk treatment. Acutely, nifurtimox is used. And this isn't a drug name that we've heard before, so we obviously don't have a symbol. So, despite this sunny weather, we'll be giving Che's girlfriend here some furry knee-high moccasins. So these knee-high fur moccasins are for nifurtimox. Nifurtimox. That's the best we could do. Unfortunately, there's no known effective treatment for chronic Chagas. So that's all for Trypanosoma cruzi. Be careful out there on your South American adventures, and don't forget your insect repellent.